Well, good afternoon, and again, thank you all for joining us for another announcement. Since we met yesterday, it has become clear to everyone that states all over the country need to take a greater leadership role in response to the COVID-19 outbreak. The situation is fluid, and it is changing rapidly. Virginians should know that we have long-standing plans in place to deal with pandemics. We have trained for them, and we are ready for this. Today, we're taking 4 actions. First, I am declaring a state of emergency in our Commonwealth. This declaration implements our long-standing emergency operations plan. This plan will be led by the Virginia Health Commissioner, Dr. Norm Oliver. While Virginia has been thoroughly preparing for weeks and has adequate funding to address the situation, this declaration will give us increased flexibility to ease regulatory requirements and procurement rules, continue federal and multi-state coordination, and ensuring ongoing support for the most vulnerable Virginians. Second, I am canceling all specially scheduled state conferences and large events for the next 30 days. That includes a Women in Innovation Conference scheduled for next Tuesday. I know that much planning, work, and time goes into these events, but I believe that this is the safest course of action at this time. I am encouraging localities and private organizers to similarly limit large events based on consultation with their local health departments. I advise Virginians to avoid large gatherings for the time being. I am also prohibiting out-of-state work travel by state employees for 30 days. We are directing state agency heads to make reasonable accommodations in regions like Northern Virginia and border communities like Bristol where that is not practical. We will assess these directives going forward. We anticipate that this break will allow time for more testing kits to become available. And let's talk about testing kits for just a moment. So far, as of this afternoon, 15 people in Virginia have tested positive. All of them have been traceable to a specific source. We are also aware of 2 Virginians who are currently in Texas and tested positive there. And we are working with Texas to determine the best course of action for them. I want to be clear. Right now, we believe we have enough testing kits in Virginia, and we believe more will become available. It is clear, however, that the CDC supply chain is in fact limited. So here's what we are doing. We are looking at developing our own test kits. There are also private labs in Virginia authorized to run these tests. While the state is not involved in that work, we understand the private labs are upgrading their capabilities to do more testing. We are watching the experiences of other states, including the use of drive-through testing, and we're considering that option as well in our Commonwealth. Ultimately, all of these steps will depend on public health needs supported by science. Third, for the state employee workforce, we are taking actions to phase in telework and other remote working options as appropriate. For official public meetings, we are working with Attorney General Mark Herring to issue guidelines that allow public business to continue in full transparency while acknowledging the seriousness of the public health threat. And for public schools, as Dr. James Lane, our Superintendent of Public Instruction, said yesterday, we continue to urge that public schools make their own decisions in consultation with local public health officials. Those decisions will be tailored to local needs, taking into account the differences between our densely populated and our rural areas. There are some factors we know our school divisions will take into consideration. For example, Schools build days into their calendar for snow days. But in most parts of the state, we have had a light winter, and those days should be available. Schools need to consider how best to serve their students with disabilities and make sure there are accommodations. And while rates of absenteeism are typically factored into our accreditation process, this emergency order will give authority to issue waivers for that requirement. I know students may have plans to leave the country for spring break, and schools are considering their risk level when they return. We know the private sector is also taking many similar steps. We know that their actions and ours will have economic consequences. The fourth action today is that I am directing our top economic officials to continue to assess how this will affect our economy and what we can do to mitigate that. Our goal is to get everyone back to work as quickly as possible. But make no mistake, protecting public health is our top priority. That is driving all of these decisions, and it will be the determining factor of all our decisions as this situation moves forward. Now, before I turn to your questions, let's talk for a moment about what you across Virginia can do. Many people are asking, what do I do if I think I have symptoms? The first thing to do is to call your provider. Doctors can order tests, and they will do so based on medical necessity. Primary care doctors can perform the swab, that is the initial part of the test. Our health department has communicated with our doctors and health providers about the steps to take after that. As you heard from the folks from the Medical Society of Virginia and the Hospital Association yesterday, our health providers and facilities are regularly providing guidance to their members. But remember, there are things you can do to protect yourself and others. If you are part of a high-risk population, that is, if you are older or have an underlying health condition, you should be especially cautious. Avoid large crowds and avoid traveling if possible, especially on airplanes. And for everyone, you have heard me say this before, wash your hands with soap and water, cover your mouth and nose when you sneeze, stay home if you feel sick, and avoid touching your face. We understand how critical it is to stay in front of this disease. While it is very likely to spread, our actions can help mitigate how fast and how far this virus spreads. It is our responsibility, every one of us, to take this seriously and to do our part to help limit the spread of this disease. I appreciate the legislators joining us. I know you all have had a busy day. I would remind all of you, this is a nonpartisan issue. We are all on board to make sure that we keep you, Virginians, safe. We also are all on board to make sure that we give you the most up-to-date and accurate information as it becomes available to us. I thank you all for being here again today, and I would be glad to address your questions.
Laura, can you tell us more about the new places where they're located and if there's any overlap with the
Yes, thank you, Laura. Dr. Pete.
So we have 17 people in Virginia now, or Virginians, that have been diagnosed with the novel coronavirus. 2 are in the central region, 4 in the eastern region, 10 in the northern region, and 1 in the northwest region. So of the 6 of the new cases today were contacts of cases that we had identified. And while we were doing the contact investigation, we had identified them and they were tested. 2 others, as the governor described, were diagnosed in Texas.
So it's 17 in Virginia and 2 in Texas?
15 in Virginia and 2 in Texas.
Yes, Maryland about an hour ago announced their first case of community spread. Have we seen evidence of that in Virginia, and how would
questions.
We have not seen spread. We have not seen signs of community spread. So what that would mean is if we're testing people and we're interviewing them to get information about risk factors, and we don't find any, and so we don't know where it came from. So we understand now where people have acquired this virus, so traveling overseas and from other people that we know had the case. So in Virginia, 4, and the CDC is investigating this, and what they've done is to go back and look at the people who attended the cruises that were of concern, and they notified states of those individuals, and states have been reaching out to them to do monitoring.
Regarding the two cases in Texas, are they going to remain there until they have recovered, or are they being brought here?
We're still working through that process now.
Governor, you said it's become increasingly clear that states have to step up
Yes.
and respond. What do you mean by that? Why are you doing this?
Well, I think a couple of things I would say, Alan. First of all, I want people to understand that we have been working diligently on this for weeks. Even in the case of pandemics, we have had plans in place. I think it's also clear that things have changed. Obviously, this has been declared a pandemic by the WHO yesterday. We have new cases in Virginia just since I spoke to you all yesterday, and quite frankly, we're getting mixed messages from the federal government. We find that unacceptable, so I'm taking the lead on this, but we will do everything, continue to do everything in Virginia to keep Virginians safe.
Sorry, how is the state exactly going to go about developing its own testing?
How much time do you have, Alan? We need to go back to biochemistry 101, I think, for that. But if you, I don't know any other. It's a very complicated process, Alan.
Is it like at UVA, like who's going to be doing that? Where is this?
Yes, our university health systems are looking into that, and there's other private labs that are also looking at developing tests.
So just to follow up on that, so I believe you said earlier there are currently 500 to 600 tests for the state lab, and you've asked for more from the CDC. What's the timeline for when there might be production of these state tests?
Refer to Dr. Tony.
Good morning. I'm Dr. Denise Toney. I'm the director of the Department of General Services Division of Consolidated Laboratory Services. So with respect to the test kits and the numbers that we've provided, when we have the capacity to do 500 to 600 tests, actually those are the ability to test 500 to 600 individuals. We oftentimes test multiple specimens per individual, so I did want to at least clarify that. With respect to the development of new tests, anytime there is an emerging infectious disease, there's a lot of information about the virus out there, the genetic sequences of the virus, the targets. All that information has been made publicly available by the Centers for Disease Control and Prevention. So laboratories that want to develop their own test have access to the targets that are being used in the CDC assay that the state lab is currently using, and so they can develop tests for use in their own lab, and those are called laboratory developed tests. They do have to apply for approval through the Food and Drug Administration to use those tests. The state lab is also looking at that as a possibility. However, because we do have access to reagents that are quality assured, approved through the Food and Drug Administration under emergency use authorization, and because we feel we have adequate test reagents now to be able to handle the testing demand, we are focusing on using those reagents that have been standardized and provided across the nation for all state public health labs to use. In the event that we become concerned that we cannot manage the testing capacity, we have experience and have brought up tests in our laboratory to be able to respond to emergency situations. And so we would be in a position to do that as well. And we are also working with universities, hospitals, as they are developing their tests, so that we are all in communication, working in partnership, and that when they bring up those tests, they are required to have their positives and their negatives sent to a laboratory such as the state lab to be quality assured, so that we have confidence in the tests that they are doing as well. So we will have a role in that. So it is multifaceted how this would play out as other labs start bringing up laboratory developed tests. I hope that answers your question.
Are there any young people who have been found positive for the COVID-19 who are healthcare providers, doctors, nurses, anyone like that?
Go ahead.
So to protect individuals' privacy, we're not sharing information about individuals.
Yes. I mean, how can that policy be justified in light of containing, the spread of the disease in terms of limiting that geographic specificity? I'm just wondering, because we see other countries doing, very specific locational maps like Singapore.
We have specific maps as well. I mean, we're obviously identifying and tracking where the cases are.
But regular Virginians can't really know with specificity where these cases are, for the most part, at a city level, or even county level.
Well, I mean, I don't know how specific you want to be, but we can certainly look at the locations in Virginia where the cases have been identified, and that's public information.
Okay, can I get that one more now?
That we have enough specific in Virginia, but at the same time that we can develop our own. I think people are astounded by 500 being the number given over 8.5 million Virginians here. Can you talk more about how we'll mitigate community spread given that we can't test people?
Yeah, obviously, we're using discretion and looking at the risk factors and the symptoms, and we use that discretion to determine who is tested. Using those criteria, we have the test capability. Again, I can't predict. As I've said, this is a very dynamic process. I can't predict what's going to happen tomorrow, but if there are more cases, more individuals that need to be tested, obviously we will require more test kits in Virginia. And so while we can't definitely predict that, we can certainly anticipate it and do everything that we can to be prepared, and that's what we're doing.
Thank you so much.
Thank you all.
Go like this, Governor.